Hey guys, it's me, Dr. Katz again. Next up in the Audible blog series, Catch Up, is called We Are All Tired. So, hey everybody, show of hands, who seems to be tired all the time lately? I bet there's a ton of you. No matter how much sleep you get, no matter how well you eat, no matter how much caffeine you drink, that thick blanket of fatigue just never leaves lately. But why? My guess is that this persistent exhaustion isn't actually just physical, it's emotional as well. I mean, sure, I'm one of the believers that constant mask wearing puts you at risk for CO2 retention and respiratory acidosis, which can cause fatigue, but I know that's not the whole story. So why are we so exhausted? You know, there are 10 basic causes for fatigue that are the most common. Some of them we do to ourselves, and some of them we have no control over. Let's review. First one, poor diet. If you eat a diet full of refined sugars and carbs, you will be wiped out because that's all you get is short energy bursts followed by crashes. Likewise, if you're trying to diet and you're not actually getting enough calories to keep your body going, you will simultaneously just drain your own energy reserves throughout the day. On the other hand, if you eat a well-balanced diet with no meal skipping, you'll stay fueled the whole day. So the second one is using electronics before bed. I am totally guilty of this one. I mean, who's not filling their heads with the latest anxiety-causing social media right before they want to go to sleep, right? Sometimes it's the only time we feel like we can catch up on the world, right? Did you know that using electronics before bed turns up your fight or flight response, which increases your pulse and blood pressure for several hours? It also decreases your melatonin levels. Both of these things are sure to keep you up longer. Ideally, you should aim to unplug at least 3 hours before bedtime to give yourself a fighting chance. So third one, sleep apnea. So sleep apnea usually happens when you literally stop breathing multiple times during the night, even if you don't know you're doing it. This happens because your airways close while you're sleeping because of extra soft tissue. Not sure if this applies to you? Ask your bed buddy if you have one. If you're keeping them up at night with your intense snoring, and the answer is yes, then talk to your doctor about it and get treated. Fourth one, anemia. If you're anemic with low hemoglobin, your red blood cell count is low and they're not getting enough oxygen, and therefore you are tired all the time. The most common cause of anemia for women would be iron deficiency from menstrual blood loss. Some symptoms of anemia might be skin, pallor, elevated pulse, fatigue, or weakness. If you think you're anemic, talk to your doctor before self-treating. Fifth one, diabetes that is undiagnosed or poorly controlled. So diabetes causes excess sugars to stay in the bloodstream instead of going into the muscle where they can be used for fuel. And as a result, you stay fatigued all the time. Some symptoms of diabetes could be like frequent urination, excess hunger, excess thirst, and fatigue. If you think you might have diabetes, again, talk to your doctor. You get the pattern here? Sixth one, dehydration. We are all racing around lately without stopping just to try and keep up with the world around us. One sign of dehydration could be darkening of your urine when you go to the bathroom. If you notice that, start increasing your fluids and see if it changes. We need to take the time to drink water frequently throughout the day. Experts say we should aim for at least 3.7 liters or 15.5 cups a day for men and 2.7 liters or 11.5 cups a day for women. So how many of us are even close to that? I better get drinking. Seventh one, too much caffeine intake. I think that the world in general is guilty of this nowadays. There are no dietary recommendations for caffeine. It can be found in some medications, chocolate, caffeinated teas and sodas, and energy drinks. While caffeine can give you a temporary boost, it doesn't last. How much caffeine is too much depends on the person. The effects of too much caffeine include increased blood pressure, elevated heart rate, premature heart contractions, and headaches. With caffeine, it's really a vicious cycle. You start drinking caffeine because you're tired. The caffeine then makes your body race, and then you get more fatigued. Then you find yourself needing more caffeine. Then when you try to wean yourself off the caffeine, you can get ridiculous headaches as it washes out of your system. In an ideal world, I would say don't even try it in the first place. Mind you, I'm saying this as I'm sipping my dollar-sized McDonald's coffee. Yup, I confess. So the eighth one is chronic infection of some kind, most commonly like a bladder infection. If you've been recently treated for a bladder infection and have no other symptoms except for a lingering fatigue, go back to the doctor and get rechecked. You could have some infection left over. Ninth one, thyroid issues. The thyroid is that little gland in your neck that literally has its fingers in everything. Multiple body functions, not the least of which your metabolism. If your thyroid is underactive, like hypothyroid, that could slow your metabolism and make you feel really sluggish. It could also affect your skin and make it difficult for you to lose weight. If your thyroid is really underactive, You might even notice a bulge in your neck and have trouble swallowing. If you think you have thyroid issues, again, what am I going to say? Call your doctor and get checked. Okay, now here we go. Here's the big one. Last but not least, depression and stress are a major cause of fatigue. At least 25% of people suffering from depression report fatigue and loss of appetite, in addition to the classic depressed mood that we think of. This is the one that I think is really affecting all of us right now with the state of the world like it is. Depression causes feelings of sadness, anxiety, or hopelessness for an extended period of time. People who are depressed often have sleep problems, which only adds to the fatigue. Stress stimulates our flight or fight response, which overtaxes our metabolism and can leave us feeling worn out and tired. Who doesn't feel all those things right now? The world is just not the same. We feel out of control. We feel like the joy has been sapped out of all our favorite things. We're spending a lot of energy looking for someone to blame for how things are instead of using our energy to deal with it. In my practice alone, the percentage of patients I'm helping with depression has risen 75%. This is a real problem and we need help. So we've talked about the causes. For the first 9, the strategy is fairly obvious, right? Treat the underlying condition and the symptoms should resolve. Correct the lifestyle slip-ups and symptoms should get better. But the last one, depression and stress, is a much harder mountain to climb. There's no one strategy that works for everyone because it's not a straightforward issue. You know, my first suggestion is going to be, right? Talk to your doctor. Clue them into what's going on with you and maybe they can help. Talk to your family and your friends. Maybe they're feeling the same way. Support each other the best we can. Seek counseling and therapy. I know that I personally have a list of counselors ready to help at my office at any one time. Don't try to tackle it all on your own. There is no harm, no foul, and no defeat in seeking help. The real battle is lost when you don't take advantage of the resources around you and something terrible happens. Then the consequences spread like ripples on a pond, not only affecting you, but everyone you care about as well. Make sure you take the time to realize your own importance, especially now. No one can do that for you. I will make you a promise right now that we doctors are here for you. We understand and we're tired too, but we'll always be here. Have a great day.